Hello, everybody. What's up? Welcome back to our podcast, Layla Tells All. Today we have a special guest with us from Sankofa. Would you like to introduce yourself?
Yes, my name is Sequoia Kemp. I am the co-founder of Sankofa Reproductive Health and Healing Center, and I'm also the founder of Doula for a Queen.
Yes, and today we also have our host. Give a little.
It's your girl Nadia. I'm back, and first weekend doing podcasts, and I love it. I hope they let me stick around.
Love to have her on here. Okay, so let's get down to the topic. Let's get down to the business. So, okay, my question is, what does maternal health means to you?
Okay, so maternal health for me, it means the mental, physical, and emotional health of women. Considering they say childbearing women, and so that is from our period, so puberty up until menopause, and all the different experiences that come with that.
Yeah, because us women go through a lot.
Yes.
People don't know the pain that we go through, especially women of color too. Because people don't think that our pain is real and everything else. We go through the same pain that y'all do. We just know how to handle it better.
Exactly.
That's all. That's it.
Yeah, that's really focused. So I work a lot with, folks from 18 upwards, but it really just making sure that we have what we need. We have the right foods. We have the right access to therapists if we need them. Really just thinking about how we can set all of us up for success.
Yes. Okay. So, what are some issues, like main issues that come with maternal health in women in pregnancy?
I think you hit it right on the nail. One of the biggest things I hear is that people just don't feel listened or heard to.
Yes.
So a lot of times, if a client just doesn't understand a diagnosis, right? It's like, I'm trained. I'm in school to be a student midwife. To be a midwife, so I'm a student midwife right now, and we're trained to explain things, give them information. We make diagrams. Like, you don't want that person to leave out that office confused.
Yes.
And that is really the norm. So a lot of times our clients will be like, "This is what my labs say. This doctor say I have this, but they told me I didn't have," like I just had a client who's like, "I didn't have gestational diabetes, but now they saying I do." And so being able to she walked out of the office not understanding how she could be negative, not have it in 1 minute and then have it the next. And so people have that distrust, like, okay, are y'all trying to set me up for an induction? They're already talking about a C-section. And I'm like, whoa. Like, so a lot of times it's just people don't feel like they're included in the process. It's just like they come, they get their vitals checked, and they're like, okay, everything's fine. But the questions that they might have don't get answered, and that can give people a lot of anxiety, especially if it's their first time being pregnant.
Okay, so what type of advice would you give somebody who the doctor said that they will need like a C-section, but in reality they really don't need it? They just trying to. My tongue ring ball just came out. And I can't find it. I probably swallowed it while I was eating mac and cheese.
What happened?
My tongue ring ball had came out, and I think I swallowed it when I was eating the mac and cheese. So it's gonna be a little bit difficult for me to talk. But so what advice would you give somebody who the doctor said they need a C-section, but in all reality they really don't? It's just
So the first thing is I always ask questions, right? So like, what is the medical diagnosis? I teach my clients you want to gather as much information you possibly can so that you can make an informed decision. Sometimes clients will advocate for themselves, if their vital signs, so like if their blood pressure has been fine, if the babies, they do this thing called the biophysical profile where they check and make sure there's enough fluid around the baby. So if everything is coming back in good normal standards, then that's a way for them to use that data to advocate for themselves. And then there are situations where a client may have went into a situation like, I don't want a C-section, but fear is a huge factor of why people might consent to something. So just making sure that is this truly what you want, right? Like, if you were to think in your heart of hearts, do you feel like you need this? And sometimes it's like, I just want to make sure like nothing happens to me and my baby. And so I'm like, okay, then that's your decision. So really, it's hard to sometimes it's hard to tell if a C-section was unnecessary because the medical establishment is always going to validate why they did the C-section. But there are situations where like my clients have had vaginal birth after C-section where you know, when they have a vaginal birth, they're like, oh, okay, you could have did it. And I'm like, there's so much data and research that shows that people can have vaginal births after C-section, but yet OBs still consider it like this high risk thing when it's not necessarily the case.
Okay, so if somebody was going to get a C-section, they got a C-section, and then they got pregnant again, and then can they give birth naturally, or would they have to do a C-section?
No, so that's the misconception that people think that once they have a C-section, you always have to have a C-section. It depends on what was the reason, right? So some people have C-sections because they have fibroids, and they and so the baby cannot pass through based on the size of the fibroids. Some people have C-section because the placenta attaches across the cervix. Yeah. So it's always one of the things that is I teach is like understanding why you had a C-section previously. Also teaching people like different exercises and body mechanics that help you to increase your chances of a vaginal birth. That can be like doing deep squats, going to physical therapy to help, you know, heal your pelvic floor. There's so many different things, but the number one thing that we taught is that the mentality, right? Like if you have the self-confidence and you are willing to do the work, then that's going to increase your chances. Just being informed and being armed with that information. So if they're telling you, oh, well, there's a risk that your cervix can rupture or your uterus can rupture, you're like, okay, so what's the percentage? And then they'll be like, okay, well, there's a 2% chance. And so then moms are like, so there's a 98% chance that won't happen. And they're like, yeah. And like, okay, well then I want to have vaginal birth. So making sure that you're asking the right questions. And it's sad that we have to say that because like providers are just supposed to do that. They're supposed to tell you these are the odds and what do you want to do with this information. Whereas a lot of times I've had a client like they just scheduled me for a C-section, didn't even ask. They just was like, oh, you having a baby on this day? And she was like, no, I'm not. So there's a lot of advocacy, and April is actually C-section awareness month, and so I tell, you know, people, you know, it's not about a competition, or people are like, oh, well, I'm not, you know, you ain't really go through it, and I'm like, no, C-sections are hard work. The healing can be really rough, and I tell people, as long as you had a baby, you had a natural birth. I try not to there are benefits to doing unmedicated, but like everybody knows what they need, and that's my philosophy. I'm not going to tell somebody don't get an epidural or don't get pain medication, but I will let you know that interventions will increase your risk for a C-section.
Okay, that's nice. I did not know that it was April was C-section awareness month. Did not know that. Learn something new every day. Okay, so how do you feel about doctors that like not give advice, but tell the patient that they have to get this without really explaining why they want them to get this? And what's the best benefits for that person? Because, you know, some doctors, they'll just tell you something and then they won't really go into depth about like, what's the procedure, what's going to happen, what's the percentage of it coming out successfully and unsuccessfully. So like, how do you feel about
I think
things
that,
like that?
One, it's like the nature of our healthcare system doesn't allow for actual conversation, right? So this does not give them an out, because I think that at the end of the day, when we decided to become healthcare providers, we took on the responsibility to be ethical providers, and that is to make sure that whatever decision that person ends up making, they have to live with it for the rest of their lives. And that's something that I don't think doctors often think about, right? So they might say, we're going to induce you because the research says we can do so. But if that induction is traumatic and that person now maybe wanted 5 kids, but now they don't want to have no more kids, then like that's a experience that they have to live with the rest of their lives. So for me, I'm like, for providers, it might just be like, we do this every day. This is the run of the mill. And I'm like, but this person, this is their only time they're experiencing this for the first, like, even if you have 5 kids, those are 5 moments in your life where you have to make like really big decisions. So for me, that's why doula care is so important, because those appointments, based on how our healthcare system is set up, is 15 minutes, 30 minutes, right? Like my appointment might be 30 minutes, but you might only see the doctor for 15 minutes. There's no way you can truly give somebody informed consent and explain procedures in 15 minutes and answer all the questions before you're like, okay, well, if you have any questions, message us on my chart because I gotta go to the next patient.
Yeah.
So I think it's like really definitely the system and how it's built, which is why I decided to become a out of hospital midwife, because most of the midwives I see, the appointments are a minimum of an hour. So you're not rushed.
Yeah.
You're able to take your time, ask questions, and they really get to understand who you are emotionally, physically, and then you can have information, right? So it's like some people are visual learners, so some providers might have to pull up a video. This is what the C-section. I do that. I'm like, okay, we know you have a C-section. I'm gonna give you like an animation so you can see what's gonna happen to your body.
Yeah,
because
like show proof.
Exactly.
Like, I'm gonna show you this so that you can ease your mind about everything that's going on with maternal health, giving deliveries, doing deliveries, and having a healthy infant baby.
Exactly. So I'm always like, let's not rush through this. If if the person is not in immediate danger, then we're gonna spend that time to explain those procedures.
Yes, that is, yes. Because people do need explanation, because when I be going to my doctor's appointment, I be wanting to ask questions, but I be like, I feel like they're not really going to give me like the explanation that I want. So I really don't ask the questions, and I know that could be.
Sometimes it's good to ask because you don't know exactly what to ask or
Yes.
how to ask.
Exactly.
So it's like, that's a whole process in itself.
Yes, it is.
And even how we communicate, right? So like, I had one client, she was talking about her allergies, and she was like, what happens if you get that medication? And my client was like, I'm out of here. And the doctor was looking at her. I'm like, she means that she goes into anaphylactic shock, like she would die.
Yeah.
So like, even stuff like that, like if they don't understand our lingo, they might be like, what does that mean? You know, she was like, I'm out of here. I'm done. Exactly.
No, for real.
So having that cultural guide is important.
That is true. Most definitely, that is true. Okay, so what are some ways to improve maternal health and infant health?
Well, number one, we need more healthcare providers. I'm currently working on a campaign to get certified professional midwives licensed. That's what I'm on the track to do. And we are based in the community, right? So like we might have, this is what our clinic might look like, a setting like this in the community. And we are able to support people whether they decide to give birth at home, at a birth center, and in some clinic models, you can provide prenatal care and then they can go give birth at home.
Yeah, because I like this one. It's a nice little cozy setting. You'll be comfortable. Like it's warming. Like
exactly.
Like okay, yeah, she know what she doing. Like yeah, I'm gonna get all the information that I need. She understand the lingo. She understand what I've been through, what I'm going through.
Yeah.
Like she knows. She knows me. Like
exactly.
She knows me without knowing me. So like you get that good comfortability. Like and we need that.
And then as far as infant health, honestly, it's educating parents. Like there's people that's like, oh, you're gonna get that maternal instinct. You're gonna be fine. That's not always the case.
I feel like that's just not good advice.
Yeah,
like you're basically telling them you got it. Like with not giving, like someone's coming to you like, oh, like I need help on this, and this. Oh, the maternal instinct will kick in. Like you literally didn't help me at all.
There's a lot of people that really don't have a maternal instinct. It's like everybody just not gonna instantly, okay, I'm a mother. I gotta do this. No, people don't have that type of mentality. Like, so it's like it's hard to just like say that.
Yeah. Exactly. On top of like postpartum depression, where it's like, okay, you may have like been changing your like way of thinking throughout the pregnancy, but then like that comes and then it's like a whole 180 and like you're back between like before you started, and so it's just like one of those things where it's like you can't just
the education can't stop once
I know like sometimes reading a book, but sometimes reading a book really don't help sometimes because like you don't know if that like if they base in what they learned on like their experience, because everybody go through different things. Everybody is different. Everybody is not the same. People don't have the same high tolerance of pain and everything like that. So postpartum, it might be different for somebody else, and this book is just not helping of like trying to get through it. So it's like.
And having peer support, like there's this notion that, because you were raised, like what if they grew up in a household that didn't have healthy parenting styles or didn't have access to clothes, diapers, wipes, right? So like sometimes I'm just teaching my clients how to make a bottle properly. Sometimes I'm teaching them like, hey, you have too many layers on your kids because you know, that we don't want babies to get overwhelmed and go overheated. So like, if sometimes it's just those little things that the person's like, oh my God, thank you, because I was just doing what my grandfather told me or my grandmother, and a lot has changed since. A lot has changed, sorry. Since our parents and our grandparents had kids, like research has evolved.
Yeah.
And so it's so important for me to be able to say like, hey, like why we don't use baby powder anymore, because baby powder was found to cause cancer.
Yes.
And so it's like babies have small airways, so you don't want that powder, that baby inhaling the powder. And I remember I had to teach a grandmother that, and she was like, I had no idea, so thank you. So that for me is infant health. One of the things that we're seeing around is just like, you know, there are parents who have drug dependency, so making sure that their parents are getting access to drug rehab so that they can have healthy babies.
Exactly.
And also not just criminalizing them, but realizing that oftentimes people turn to drugs and substances because something is unresolved within themselves, and so helping to teach them those skills of resiliency and inadvertently help support infant health.
Nice. Wrap it up. Okay.
I feel like I love like sitting down and having this conversation with you, because like I am friends with Pri, and so like I have always been, and so like I've been supporting like doulas and like the work of midwives and everything for years, and like I've never actually like sat down and had like an in-depth conversation.
Like I literally found out like what a doula was, because like I just knew like midwives, but then they said doula. I'm like, doula? What's a doula?
Yeah, and so it's just one of the things when I'm like ready to have kids and stuff, I definitely want to go down this route and like have someone there that's, because no matter how much homework you do, like as a woman that's like not right in the field, you're never gonna know everything. And so it's nice to have like someone there like advocating for you, someone that's informing you on the things that you don't understand, someone that's like putting it into words that you can understand.
Exactly.
And so it's like people like you just make me so excited. Like I love it.
I love this work. I've been doing. The first birth I attended when I was 13 years old, and I tell her to this day, like I thank her, because I was just a 13-year-old who just went through surgery and lost an ovary. And so, well, I didn't lose an ovary at that time, but I got diagnosed with ovarian cyst. So I'm 13, just had major surgery, and my babysitter happened to be pregnant. So I was going to her appointments, and her allowing me into that sacred space is why I am the doula and future midwife. So like you said, you need to have people in your village. There are people, my oldest doula babies are like 9, 10 years old right now, and their parents still ask me questions like, hey, what's going on? So you do truly become somebody that's trusted, and you watch them grow up, and hopefully in a couple years I'll have some doula babies that are adults.
Yes.
Okay, everybody, we will have to cut the podcast. It's almost time to go. But is there like anything that's upcoming for doulas, or is there any type of training that people can get if they are interested in becoming a midwife and doula?
Yes. So if you're interested in becoming a doula, I am going to be hosting a doula training in July. It is for people who are interested in working in a collective model. So you want to work with at least one or two other two other doulas, because we're not islands and people burn out when they try to do this work alone. So that is going to be, I think, the second week of July, and I can make sure that the girls have the information if you're interested in becoming a doula. And honestly, we're just trying to get this bill passed, the Certified Professional Midwifery Bill. It's currently in the legislature in New York, so we just want to get that passed by June. But we just need people to go to nycpmidwives.org and learn about our bill.
Okay, folks, you heard it here today. Information will be in the comments, concerns, subscribe, share, like, follow. We'll see y'all next time.
Bye.